Again, it's Garrett with NSCA Strongman Sig Talks. Today, I have the privilege of sitting down with Dr. Andrew Mock. He is a professional 105 kg competitor. He's won Georgia's strongest man, California's strongest man. He somewhere in the top 10 at Clash of the Coast, 6 world's strongest man. Then he's also competing his residency. He's a family physician, preventive lifestyle physician, all that good stuff. So he's very, very smart and crazy strong. So I'm going to talk to him today about strongman and its role in the rehabilitation physician world and whatever else might come up. So anyways, Andrew, nice to have you. First, give a little bit better introduction than myself. Talk about yourself a little bit.
Sure.
Yeah, just general, whatever, strongman.
Yeah. So I'm a 4th year family and preventive medicine resident. That means I'm in my last year of training. And then after this year, I'll be able to sit for both family medicine boards and preventive medicine boards. But the institution where I train does a lot with lifestyle medicine, which is all the good things we should be doing to treat a lot of chronic conditions in terms of diet, exercise, sleep, stress management, limiting substance use, and increasing social connectedness. But as far as athletic background, I do still compete at strongman at trying to be the highest level, but currently recuperating from ACL reconstruction just 8 weeks ago. And that's where we are right now.
All right, cool. Yeah, we're gonna get all into that in a little bit because talking to you and Jeff Young, I'm really interested in the whole AC. I'm gonna use your what's the
ACLM, American College of Lifestyle Medicine.
Okay, American College of Lifestyle Medicine, because that's extremely interesting. I think that's gonna have a huge impact on the medical side and the fitness side. We'll talk. I have some viewpoints, so we'll talk about that a little bit too. But first, before we get into that, let's talk about you and Clash on the Coast and this movement with the Anthony's putting a lot more focus on the 105 guys, a lot more interest on female competitors. Again, with this SIG, we want to raise awareness and get research, and to get research money we need people who are interested in strongman. So talk a little bit about that and how you think that's going to grow the sport, and then how that will eventually maybe help the SIG and just basically all around awareness.
Sure. Yeah. So Anthony Furman, for those who don't know, he's a 2-time world's strongest man in the 105 kilogram class. He has also started the company Strength Fleet, who is what I would consider like an elite athlete training company, but then also he's doing this competition promotion that's really like forcing everybody in the game to change their game. So he is getting a lot more money and interest going towards the weight class athletes, starting with the 105 kilogram men, purely because that's where he competes. And so that's where his interest is highest. But hoping to spread that out to all of the other weight class athletes. So that way these world-class athletes can have their seat at the table, as he says, to, actually be able to put themselves out there at the highest level and, be treated with respect and compensated for their time. So Clash on the Coast we had in May, and we were actually broadcast on July 4th on ESPN to the finals were there. And so now he's moving forward with 4 different events that are going to be a qualifying series where cash prize is offered to the podium, and then even taking that further to doing Clash on the Coast again the following year, and putting up his own money and his own company's money to increase the prize pool in the 105 kilogram athletes at 105 kilogram world's strongest man. So it's I think we're seeing a response from Strongman Corporation by now opening up America's Strongest Man to non-pro strongmen that are competing at this elite level. So you have guys like me, Alex Bromley, Tyler Young, Josh Isley, Reed Tompkins, who have all been placing pretty high at Strongman Corporation comps, just not in that top 3 to get their pro card, and but are going to these other international level competitions and, well within the top 10, but we're still not considered, as far as Strongman Corp is considered, pro strongman because of how
You're not
qualification. Yeah, so I'm technically not a pro strongman from a Strongman Corporation side of things.
Okay.
Yeah.
Yeah, I guess that I'm not real familiar with the whole. Yeah. It's confusing to me. It's like, when do you become pro? All that
right. Stuff. But I did beat all but 3 pro strongmen at Clash on the Coast.
Well, that's, I mean, what weight are you walking around? I see like 240.
Yeah, I stayed pretty close to our competition weight, 231 pounds, 105 kilograms. So I'm trying to put on a little size, or at least not lose size with the ACL rehab. So I'm somewhere between 235 and 240.
Okay, cool. Yeah, that's one thing I think and again, it's not to take away from, the big guys, but there's something about the 105 guys, because you guys are cut and lean.
Yeah.
What do you guys, your average 105, you're like 15% body fat, maybe 12, 15?
Yeah, I would say the top 10 guys from Clash on the Coast, probably the leaner of the group. I would say, I don't know if anyone is over 18% body fat.
Okay, yeah.
So I mean, some of the leaner of us being around 8 to 9.
that's so you got under 2. That's insane. I don't even know how that's even possible to do the stuff you guys are doing. Because I was I got a bone to pick with y'all, because my girlfriend, she's always talking about blah, 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 blah. And then I was like, I'm interviewing this guy, Andrew Mock. She go, I want to see. And so, show me your Instagram. It's like, he has abs and he's strong. Why are you fat? So you guys are putting a hurting on us open weight, weak guys. So just off the ball, so what are you deadlifting? I'm trying to get like a good ratio body weight to.
Yeah. So my all-time best pull, I'll tell you, this is what I think. Honestly, I'm as far as the elite level 105 athletes, one of the statically weaker guys.
Okay.
So take this for what it is. But my all-time best deadlift is 700 for a double.
Okay. So that's still 700 a double. You're about, almost under 3 times body weight. 3. Yeah. So, there's something like, I think visually, just aesthetically, pleasing, if we will, to the outside world, that could be a more attractive sport. Again, that's nothing against big guys at all, but in creating that, I think having this, because when I first started, I always thought strongman, these big, insanely huge dudes, where it's like, that's cool, but I'm not bulking up to 200 kg. I'm not doing that. But with you 105 guys, it's like, man, you can be lean, you can be cut, you can have a 6-pack and be strong as hell at the same time. So I think that's real attractive, just visually, to the outside world. Let's talk about it. Mention this a little bit about you and the thing. So you do have your bigger guys, and I wanted to get your opinion on health factors. I don't, that's why Eddie Hall, he dropped weight for health. Right. I don't think any of those guys think that it's healthy being 200 kg or 150 kg. From your background in medicine, if you are going to venture into those heavier weights, are there some things you can do to make it less of a risk?
Or absolutely.
Okay.
Yeah. So I'll say a little bit more about this. So a lot of people don't know what preventive medicine is. They think it's just like, preventing disease, but that can act at many different levels. So a preventive medicine physician may see individual patients, but they may also be like at your county, state, federal level of public health. So either your county Department of Public Health or going all the way up to the CDC and like writing national guidelines. So that's kind of the background where I'm coming from. And a lot of that does include epidemiology. So when you're talking about like excess adiposity or excess fat tissue, I think there's this pretty big disillusion in strongman of like BMI being an absolutely terrible metric for us, because we just have so much muscle mass that it just doesn't matter. And I think people don't actually realize how rare it is to have someone that is actually obese or a BMI over 30, while still being, very low body fat.
Mhm.
Those are like rare people. I mean, the 105s, a lot of those guys are probably some of the few that are actually, at a low body fat while still being in the obese category. So the problem there too is I think it's so rare to have someone up there. We don't actually know how bad for you all that extra lean body mass is, because like, who are you going to study? That's the question. So what we see though with respect to BMI is once you get over 30 BMI or classified as obese by the definition, like your mortality goes up. So that curve goes up. And yeah, and so there's a clear relationship for every 10 pounds you add with how much more likely you are to die for any reason. So especially during COVID, this was my thought of like, we're going to Strongman Corp Nationals in Alabama, and then we got all of these open weight class guys who have a whole lot of excess body fat around their midsection, which is directly correlated with cardiovascular mortality. And I'm just like, oh my gosh, please don't just have a COVID breakout right now. So as far as things you could do, I think it would just be other things that are generally health promoting. So my first thing would be make sure you're meeting the physical activity guidelines for Americans. I think all of us in the sport are going to be meeting the muscle strengthening guidelines, which is just 2 days per week of hitting all major muscle groups and at least moderate intensity. And then something we can probably all do better on is making sure we're at least hitting the minimums for the cardiovascular guidelines, which is 150 minutes of moderate intensity cardiovascular exercise. And I think if you train strongmen in certain ways, that's totally possible to do without adding dedicated cardio. Although I do think there would be benefit to adding something like low intensity steady state cardio to improving your health. But as far as dietary things, I think that is a really big one that we like to pretend is not as bad for us as we think, but there are dietary patterns that I think are more health promoting. So in my mind, we're going to be at a caloric surplus. That's the nature of the sport. That's one of the risks we are taking. If we kept that lower, we wouldn't be where we are in the sport. So it's something that we have to do. But there are things within the diet that you can certainly do, like limiting your saturated fat to less than 10% of your total daily calories. And to me, I think probably one of the bigger ones is making sure you're getting at least 30 grams of fiber for a guy, 25 for a woman a day to actually just reduce your risk. And so hopefully getting that from whole foods. And if you think about how that happens, right, that means you're eating your vegetables and fruits. I think a lot of us drop the ball there on eating vegetables and fruits, whether that's like dietary preference or actually, some of us like myself, where it's like, man, I need more room in my stomach because I'm still trying to get bigger and I have a lot of trouble eating. So I'm like, let's not waste space sometimes. But I think actually, if I just said one thing, making sure you met your fiber goals from whole foods, that would probably take people pretty far for kind of mitigating some of that risk.
All right. So if you are going to say, I'm going to give it my all, I'm going to go that heavy weight, try to push a massive weight, still getting your basic cardio and more fiber and vegetables, right?
Yeah.
That's what I just stick a bunch of kale and spinach and regular all into my protein shake. And that's, I eat my other stuff too, but I find that's an easy way to get it real quick. You don't got to. My thing with vegetables is I don't feel like having to cook it and saute and make it taste good. So I put it in my blender.
For me personally, I don't really care how you get it in, as long as people are getting it in. But I think there's something to be said about other things that the biggest of the big, and even not the biggest of the big, do to succeed in the sport and be successful. And getting into like a performance enhancing substance conversation, at least from a medical perspective, the thing I will say is, I'll just be completely honest, there is a stigma within the medical field when it comes to taking care of people that are on performance enhancing substances. And I wish that were not the case, because we take care of people that are on a lot of things, right? And we do a lot of things to reduce their risk. So in my mind, your primary care physician or any specialist that you're seeing should be aware of things that you are doing. That way that they can help you reduce the risk by making sure that they're monitoring all the things that could go wrong, that are at least not ideal when you're talking about these things. So for me, it's the big things are monitoring your blood pressure, making sure your liver's doing okay, making sure your kidneys are doing okay, and keeping the BMI in check, hopefully, if it's from excess adipose tissue or fat tissue. And after that, it's making sure you're up to date on all your other preventive screenings. And, if you need to go down the needle route, making sure you have access to clean needles. So we're not having any risk of any needle transfer disease like HIV or hepatitis C or anything like that.
Yeah, I heard you talked about it. I listened to one of your interviews, your next door.
Your Block's Strongest Man.
Yeah. And you had started mentioning some stuff like as a physician, your job is to take what you see and advise, especially if it's health harming, advise, but at the same time, not worsen it by not giving them the correct information or correct resources.
Yeah, and exactly. And so that's what happens is like someone's scared to walk into their office because their physician will judge them. We see that in the evidence itself, that does occur. And what happens then is you have guys going out there with unchecked blood pressure and unchecked, which can lead to unchecked kidney problems. And I think all of us know of someone that has passed away, likely due to side effects of some of the things they're doing, or at least not having appropriate medical monitoring for their age.
Okay. So maybe that too is if you are a heavyweight guy, you need to have a physician who is privy to PEDs, assuming maybe you are using those. So someone you can talk to so that they know how to look at the correct blood levels and
absolutely
assign it, because obviously PEDs do have an effect on these things. So you need to have someone that you can talk to and they're educated with PEDs.
Yeah, so it's a tall task there to have someone that understands exercise, PEDs, and then also is, willing to talk to you about those things and do things that may go against some social stigmas to make sure your health is being taken care of appropriately.
Yeah, I mean, that would be, I'd like to get that conversation another day because I have my viewpoints on that stuff. But I think eventually it's going to start. I mean, now TRT is more or less accepted. Now, not that the guys might be using more than a TRT dose, but yeah, I think that is going to eventually come around as it's becoming. I think people are a little bit more open to talking about it, but all right, cool. So then last part before we get into like your medicine side. So you're a physician. You know all the physiological and metabolic systems of the body. How has that, I guess, talk about how has that shaped your training within Strongman? Maybe even did they merge? Like when did you start Strongman? Was it during physician? Did you use what you know about your body to change some things maybe you saw that was going on other Strongman?
Yeah, so I mean, that's my background, man. I for some medical reasons had to drop out of high school and get my GED. And while I was there wasting time, I just decided to go to the gym. Got into bodybuilding around 15, 16. And one of the things that happened is I got very curious. Like I see all the little muscle charts, right? And I'm like, so I got very curious about anatomy itself. And so that's how my knowledge journey started. And then, as I'm like trying to eat and make sure I'm growing, I'm like, well, what's actually happening when I'm eating this food? So what food can I eat to make this happen more? So that's how I got down the physiology trail, is really just learning about that. So I'll say it would be anatomy and physiology that kind of guided me. initially, and I, really liked learning about it. But I also found that I liked sharing what I was learning. So I was like, well, how can I learn about the human body and then also be a teacher? Well, the root word for doctor in Latin means to teach. So I was like, okay, let's go be a physician. So that's where I started. And so this entire time through my medical journey, it's been, well, what can I do where, I'm taking care of patients with all this medical knowledge that I've gained, but then also doing one of the things that should be done as a first line treatment for many chronic conditions, which is getting them to be physically active.
Okay. Okay, cool. So let's jump into that. That's kind of like that segue. So again, so right now your big thing is with well, before we get into that, so I think when I first heard you were a doctor, I immediately assumed you were some sort of a physical therapist or physio or even like a researcher, but you're a family physician, right? Preventive care. So let's talk about what exactly is your research or your specialties, and then get into ACLM and your role in that.
Gotcha. So we explained preventive medicine a little bit, but just think public health. I think that's a pretty decent way to think about preventive medicine. So it could be policy, or it could just be working at the community level or patient level, but then also going all the way up to CDC. I think people are more familiar with the family medicine physician, but it's that person that takes care of quite literally everybody. So from the youngest, cradle, delivering babies, all the way to the grave, including geriatrics as their primary care physician. So as far as the scope of practice of family medicine is just everything that's not major surgery is what they will do. Now, there's actually some family medicine physicians in Alaska that do things like taking out gallbladders and appendixes, but we're not doing that here in Southern California. So that's kind of the scope of those two. But the institution where I came specializes in lifestyle medicine. It's one of the blue zones in the world and the only one in the US, which means it is an area in the world where there are people that live the longest. So there's something about these people in this area that allow them to live much longer than anywhere in the world. And so what we have here is the Seventh-day Adventist population, which has a large component of social connectedness and a big focus on healthy dietary patterns and activities. So that's that lifestyle medicine piece coming in, which typically is thought to have 6 pillars: nutrition, physical activity, sleep, substance use reduction, social connectedness, and I'm leaving out one because it's just after 7 a.m. here, and I'm now
got you on a test.
stress, I think, is the one that I missed there. So adding in my own stress time there. But yeah, so everyone in medical school is taught that these things play a role in chronic disease as far as prevention, treatment, and reversal. But the problem is we spend so little time talking about these things. So your physician, on average, anywhere in the US, will get about 2 hours total in medical school on training for physical activity and nutrition. And most of the training as far as nutrition is focused on things that are actually pretty rare, like vitamin deficiencies. We are not very often deficient in vitamins in the US because that's the product of industrialization. And
even if you're eating junk food, you're still probably getting your vitamins in there somewhere along the
most
line.
of it's fortified, right? So that's the innovation that has come with us moving from farm to table to it being an industrialized process.
Real quick, are you familiar with the it kind of rang my bell. Are you familiar with the Army, the military? They're starting new kind of fitness things called H2F. Is that?
Yes. So they kind of shifted away from like what was it? Push-up, sit-ups, and the 2 mile
it sounds very familiar. I think they have 5 pillars. It's like sleep, physical training, sleep, spirituality, but that's in the sense of like having a purpose in life, not necessarily, and nutrition. It's very similar. Are those connected, or maybe it's just the new movement altogether?
Yeah, I know that the lifestyle medicine community and some of these changes within the military itself, they are connected. So I would say it's probably some of the same groups of people making these recommendations. And so you commented about spirituality or like some sort of higher purpose. A lot of times that's linked in terms of the social connectedness.
Yeah.
So spirituality, social connectedness, much distinctly different from religiosity or like what religious denomination you are.
Yeah, it's more like having when you wake up in the morning, like what is your purpose in life other than the collect a paycheck, right? Like
yeah. So I've kind of gone a step further down that trail, and I think specialized a little bit and focused within the physical activity section of that and moved into resistance training. So for me, the medical community does not lift. I think if you are a lifter and you go and talk to your doctor, you're not unfamiliar with that concept. And so even within the lifestyle medicine community, one thing that really bothered me, because there's also this exercises medicine group that's really trying to push physical activity in terms of promoting health. But within the American College of Lifestyle Medicine community, I remember my first conference that I went to, there's like 3 days of seminars and lectures. And I don't know, maybe that led to 50 to 100 presentations. And there were a massive 2 that talked about physical activity. And then within that, there was like 2 slides that talked about resistance training. So everything's focusing on cardiovascular exercise. And then even further, focusing on things that we don't have solid evidence for, like stretching routines. So it's just kind of confusing. And so I'm just like, what's going on here, right? It is so easy to write a cardiovascular exercise prescription. Go pick your favorite cardio activity and do it. You can do 150 minutes at a moderate intensity. You can do 75 minutes at a vigorous intensity. Divide that up however you want during the week. But the second we ask somebody to write a resistance training prescription or do any programming, people fall apart, right? They can't even name like a movement to hit all major muscle groups.
Right.
So that's, I think there is a lot of work to be done there. And so that's where I focus my attention. And so one of the things that I do within my own program, as well at the level of the American College of Lifestyle Medicine, is I'm working on this curriculum as a part of the lifestyle medicine curriculum as a whole, to actually teach physicians more about resistance training. And so that way they can appropriately advise their patients based on the guidelines to be physically active.
Okay, cool. Yeah. You had talking to you and Jeff Young. I kind of had my own impression that these guys don't know. They don't know what they're talking about in terms of, strength and conditioning. And like to hear you and Jeff Young, I'm just like, and I was talking with someone like, yeah, apparently, these physicians don't really know anything about resistance training. Like, no, yeah. I don't know. That's what I'm trying to figure out.
And so the very sad part there is, I think within the medical community, the overarching theme a lot of the times is that it's dangerous. And so you shouldn't do too much. So I think that's the big thought, is that resistance training can be harmful. So you shouldn't do too much, despite actually looking at the evidence, it's demonstrably safe. If you take something like bodybuilding and you look at your injury rate per contact hour, right, which is a very common metric used in all sports, it's somewhere on the order of 1 to 3 injuries per 1,000 participation hours. And you like add in something like tennis or basketball or soccer, which are supposed to be lifetime sports, which are on the order of somewhere like 8, 9, 10. God forbid you add something like football that's a contact sport, and it's way higher than all of those, but still no problems getting all their kids into contact sports or playing soccer, but don't let them lift weights, man. That stuff's dangerous.
Yeah, there was an epidemiology and they compared, bodybuilding is very low. The one I know of, it's like 1.5.
Yeah.
Then even strongman it's low. Technically it's the highest, but it's
right.
That's due to we have a lot of like weird, especially bicep tears. But it's like 4, something like that, 4 per 1,000 hours or something like that.